Slowly but surely, faces are being put to the numbers of those who have died. Not statistics, but mothers and fathers, children and grandchildren, all have succumbed to the deadly disease. Jean Howes is one of the latest. She was 87 and only left the house once a week for an hour to go shopping. Her son recalls the last moments he had with her.
We were allowed in with gloves and masks and gowns, but you had to sit away. You know, it's really, really hard. It's not the same. And when she passed, she was on her own because you just can't be, because of the risk. You just can't be there all the time. And that, yeah, it's hard. It really is hard.
Leonard Gibson lived with lung disease. He was used to having chest infections. His last, caused by the coronavirus, though, killed him. His grandchildren told me his death can't be for nothing.
We don't want our grandpa to just be remembered as another statistic, as somebody that died because of this thing. There is a human cost to this.
That cost is being felt in hundreds of households across the country. The death toll has risen again today, and health officials warn the worst is still to come.
What we are going to see is this huge wave of people requiring very high levels of treatment, and in that sense it is a tsunami. I think what we have to remember is that it's not just a wave of people, many people needing treatment, it's also over a sustained period of time.
One patient who hasn't needed extensive care is Jack Bowden. At 98, he worked on the production of penicillin during the Second World War. His son told me he's in hospital, but slowly recovering.
As a start, I went to bed last night thinking, if this was the end, the guy is an absolute legend, and the people that are talking about him, and the belief that he's been able to give to so many people, not just in the UK, and I just, to me, it just touches my heart.
Tonight, the XL Conference Centre in London is rapidly turning into the biggest hospital in the UK. So concerned about an explosion of cases in the capital, gallons of oxygen were being delivered earlier. If the peak of this crisis is just 2 weeks away, beds here can't come soon enough.